Hi guys, I don't give a shit about what kind of shockwave device you use. I care about that you can use it correct and you understand the technology. One of the things I'm often getting in my inbox is I talk with these one, they say this kind of device or technology doesn't work. I have been seeing these clients that have been having shockwave in another place with this kind of technology, it doesn't work. We are really good at saying, yeah, if you don't have this specific device, then you won't get the results. That is bullshit. All the devices is founded in research. There's so much development behind, and for 80% of the indications you're going to see during a day, you will get resolved with the device you have if you understand how to use it correctly. There's so many myths that piezoelectric is small focal zone. It can be just as big as an electromagnetic if you have the right applicator. They say that it can't go very deep. It can go up to 17 centimeters if you have the right applicator. They say that electrohydraulic doesn't work. It's not a real shockwave. It is a real shockwave and it's very powerful, but because of the size of the focal zone, the therapeutical zone as well, you won't feel it in the same way, but we see the results. With the electromagnetic, they say this is the only shockwave where you can be completely certain that the energy will be in the specific area. The fun thing is that when you look at the therapeutical effect, the 5 MPa, then that is also getting bigger when you're increasing the intensity. So if you do a very low intensity, you'll also have to use more pulses to cover the same area as, for instance, with the electrohydraulic. So we really need to be better at talking with each other about the technology and trying to understand what the pros and cons can be with a specific device. We also have the radial. I don't use it anymore because I'm mainly focused on men's health, so I would never put that on the penis. It would be painful, and we don't see any scientific effect. We work with the devices. We learn how to use them correctly, and I've been teaching for the last 6-7 years. And I've been teaching doctors been using a specific device for many years completely incorrect. They have some results. They at least inflict a lot of pain on the clients, and it's like decent, but if they actually knew how to use it correctly, adapt the protocol, then you could have the good results. And if you want to really be on the edge and say, this is the one device, then be sure that you have tried the other devices, because otherwise it's very difficult to get the right perception. And I will agree, for some very specific indications, one of these devices can be better than another one. But for 80%, you're going to get the results no matter what device you have, if you understand the physical probabilities of the focal zones, the therapeutical effects, the size of the focal zone, and how to apply it correctly to the client. So when I do my activities, I always look at the client. I look at the ultrasound. What do I need to do for this client? And then I choose a device according to that, and not due to some specific device because I only have one. I know it's a choice, but if you want to really discuss this, then make sure you try the different devices just for a few weeks. It's not enough just to stand on an expo and put it on your arm and then say, okay, I tried that, didn't feel anything. When I do my classes on men's health, we play with all the different devices. One of the most important things for me is that people understand how shockwave is working in the different technologies. So I don't care what you're using. I care about that you understand the technology and you can use the specific technology you chosen correctly for the specific indications. So if I'm unpopular with this message, then it's fine by me. We need to talk more, work more together than working against each other. That is what our clients need. Thank you.